to identify modifiable risk factors from index stroke to prevent recurrence of ischemic strokes. Cerebrovascular diseases are the fifth leading cause of mortality in developed countries, and up to 25% of them account for recurrent strokes in the United States. Studies have shown that about 50% of patients with history of ischemic strokes or transient ischemic attacks have an increased risk of recurrence within the first few weeks. Therefore, it becomes important to identify risk factors to prevent recurrence of such events at the time of index admission by designing a multidisciplinary approach. Our objective is to identify modifiable risk factors at the time of index stroke with adequate standard documentation, treatment, and multidisciplinary outpatient follow-up model to reduce the recurrence of such events. We performed a retrospective chart review of 40 patients admitted to the neurology service with a diagnosis of ischemic stroke between January 2018 through March 2020. We identified patient demographics, date of first and second admissions, National Institute of Health stroke scale representation, intervention, imaging studies, etiology of stroke using the TOS classification, comorbidities, and secondary stroke prophylaxis at the time of discharge of index stroke. We applied descriptive statistical methods to analyze the results. We identified 30 patients who met our inclusion criteria. The mean age of our cohort was 65.3 years, 60% were females, and 83.33% were blacks. The mean duration between admissions was 5.29 months. Embolism and small vessel diseases were the most common etiologies. Hypertension, diabetes mellitus, and atrial fibrillation were the most prevalent comorbidities. Appropriate treatment was initiated in 80% of patients at the time of index stroke. Only 33.33% had an outpatient follow-up. Stroke is the second most frequent cause of death and the major cause of disability worldwide, and consumes about 2% to 4% of total healthcare costs. The most common factors for recurrence of stroke in our cohort were poorly controlled risk factors, inadequately documented risk factors and etiology, missed event monitor or loop recorder in high-risk patients, failure of adequately documenting previous antithrombotic medications which the patient might be failing, and poor outpatient follow-up post-discharge. Large vessel occlusion and small vessel disease were the most common etiology for recurrence of ischemic strokes. Hypertension was the most prevalent comorbidity. Despite the small sample size of our analysis, the results were comparable to other larger published studies. Our focus is to diligently screen patients at the time of index presentation with attention given to home medications and compliance, to identify tests which can be applied to assess medication responsiveness, standard checklists provided to healthcare workers at the time of discharge to document appropriate antithrombotic or anticoagulant use. We can also implement a multidisciplinary outpatient models and use of predictive models such as the recurrence risk estimator, which is a web-based, easy-to-use prognostic score that integrates clinical and imaging information available in the acute setting to quantify early risk of recurrent strokes. Our study also highlights that patients with embolism or small vessel disease are at increased risk of early recurrence, and this warrants special efforts for secondary prevention. These measures can help reduce recurrences, which is favorable to both patient and healthcare systems.